Thank you, Ben, and good afternoon, everyone. My name is David Slade. I'm Vice President of Employee Health and Benefits at Marsh McLennan Agency, and we're really excited to partner with Together SC on this new association health plan. We think it'll be a really great benefit for many member organizations. Very excited to roll it out. We are an insurance brokerage risk management firm. We're the largest brokerage firm in the U.S. and in the world, so we're always looking for new creative solutions for our clients to manage risk and control costs. And we think association health plans are a great way to do that. So what we wanted to do today was to kind of introduce you to the program. It's up and running. We have several members, and we are out there talking to a lot of folks and running a lot of proposals for people. So just kind of want to do a quick overview as to, what's the problem out there? Why are we creating an association health plan? Most of you are aware premiums continue to rise at a pretty significant rate. We're looking at high single-digit trends when it comes to medical drug costs. Sometimes it goes into double digits. We've seen some small employers actually drop coverage. Employers are having to pass on a greater share of the cost to employees. The employees are paying a higher percentage of the premium. We're also seeing somewhat reduction in benefits. People are looking at larger copays, deductibles, out-of-pocket costs. And some of this is driven by the Affordable Care Act and, what's allowable and how do you index your plan based on the guidelines set by the Affordable Care Act. Economics are really challenging. You look at the average American worker making $15 an hour. It's about $31,000 a year. And then you look at these average annual health premiums. You're looking at the average single cost of about $7,200 a year, about $600 a month. And then you're looking at premiums for family in excess of $20,000 a year. So real challenging landscape. Why do association health plans work? And as I mentioned before, we are partnering with Blue Cross Blue Shield of South Carolina and Capstone Administrators. And Blue Cross has been a kind of leader in this field. There are many successful association health plans in South Carolina right now, Truckers Association, home builders, auto dealers, people like that. So other sectors and industries have done this. It's just a way for smaller groups to kind of band together and be pulled together into a larger group health policy. So it enables us to offer more competitive plan design options and more competitive pricing, a strong employer member benefit. So you're only eligible to participate in this plan if you are a 501c3 and dues-paying member of Together SC. We make sure that we meet all the compliance requirements. There are a bunch of them. That's why it took us a year and a half to create it. So we went through a lot of due diligence in setting this up. And then we have the key administrative functions that are outsourced to Capstone Administrators, who partners with Blue Cross Blue Shield on all their other association health plans. And we can offer you consolidated billing and trust services to simplify the administration. So that's provided by Capstone behind the scenes. So we can consolidate all your billing for medical, dental, vision, and we even offer life and disability benefits through Companion Life. How do association health plans lower costs? As I mentioned before, small employers are pulled together to help lower the administrative costs. It improves efficiency, and it spreads out risk among a larger group than you being a standalone group being out there on your own. Association health plans are treated as large single employers for rating and renewal purposes, so that helps. We're often able to pull small employers out of the Affordable Care Act marketplace, which has some high cost requirements. If you're a small group in South Carolina, you're in the small group marketplace, you're age rated, everyone's premium is different, older people pay more than younger people, and you don't have any flexibility there. Here, under the association health plan, we have a lot more options, and we provide people with composite rates. So that means, each individual employee pays the same amount for single coverage, and same thing on the dependent cost. And then association health plans have a higher employer allegiance, which lowers the renewal cost trends. We see cost trends on association health plans of, maybe 3 to 5% range, and on regular traditional health insurance marketplace, we're seeing 8 to 10% or even higher. And we've kind of proven those trends are lower over the last 10 years. So a little bit about the underwriting. If you're interested in getting a proposal, we'll ask you to provide some basic census data on your group, along with current plan summaries and rates. If you do have a group health plan in force, we'll ask for that information. If you don't, that's fine. I mean, we are providing proposals for some folks that don't have group plans in place. There's a general employer questionnaire. So we ask some general questions to you, the employer, the best of your knowledge. You're aware of the following. We do kind of bifurcate the underwriting a bit. If you're a group under 25 employees, we do need some additional information. We need folks to answer a one-page health statement. All the employees that are interested in coverage have to answer a one-page health statement, and we take those health statements, and that helps us set the rates for your group going forward. If you are an existing Blue Cross or Blue Choice client, you do not have to complete employee health statements. If you are not with Blue Cross Blue Shield or Blue Choice, you do have to submit those health statements for groups under 25. If you're 25 or more eligible employees, we don't need the health statements. We just need your census data and some basic information on the current plans that you're offering. So we want to offer people a lot of choices and flexibility here. So we have 18 different medical plan designs we're offering, 2 dental plans and 1 vision plan. So there's a wide range in the rates and the benefits, and any member organization can offer up to 2 medical plans. So we see a lot of people doing that, having a base option and a buy-up option. You may determine what, define your contribution, and then let your employees choose what they want. And we're really targeting 60% or more participation in the group once we account for valid waivers, which might be Medicare, Medicaid, TRICARE, governmental programs like that. So that is a goal and requirement we have on the participation side. So the advantages, we can offer you, value-added products and a service for member organizations within Together SC. This is a partnership that between Together SC, Marsh McLennan Agency, Blue Cross Blue Shield, South Carolina, and Capstone Administrators. We're all community leaders, and we have a long history of working with nonprofits throughout the state. So we want to really help. The goal here is in a competitive job market, and Bob, and you're doing a compensation and benefits survey, you're all aware how competitive it is to get employees. You're looking for new ways to recruit and retain talent, and employee benefits is a major part of that. And we want to provide you the stability of large employer benefits at competitive rates and lower renewal increases than what you might be able to get on your own. So we put together this flyer. It's regarding association health plans, we have Together SC's logo up there. It's talking about one of the reasons to join an association health plan. You're going to get local representation and focus with, Blue Cross Blue Shield, South Carolina, which is the market leader when it comes to health benefits in South Carolina. You have a single source solution between us, Blue Cross, and Capstone. All the billing administration is handled for you behind the scenes. You got plan design and flexibility, 18 different medical options, and then once again, premium savings and financial stability of being with the largest carrier in the state, along with a great network of providers. We all know that Blue Cross has great coverage across South Carolina. So this gives you an example of the wide range of plan designs we offer. There's pretty much something here for everyone. So you'll see that we offer 18 different plan designs here. We offer 5 high deductible health plans that can be paired with a health savings account with a wide variety of deductibles and co-insurance. We offer a lot of traditional PPO copay plans with different deductibles and max out-of-pockets. All of our PPO copay plans have office visits for primary care, physicians, and specialists. So, we can customize those copays to get to certain price points. We also have a traditional prescription drug card, which these benefits kick in before the deductible when it comes to generic, preferred brand medication, non-preferred brand. And then, as I mentioned before, if you have a qualified high deductible health plan with an HSA account, you're not allowed to have upfront copays. So those plans are compliant, give you a lower price point if you want to take advantage of that health savings account. And then we have 2, which we think are pretty innovative. They're health incentive accounts. They're traditional PPO copay plans that say, hey, if you, the employer, are engaged in your own health and you answer a health risk assessment online on the Blue Cross website and you go for a preventive exam once a year to your primary care doctor or OBGYN, we will reduce your deductible by either $500 under this $2,000 plan or $750 under the $3,500 plan. So you can buy down your deductible by getting engaged and doing some wellness activities. We offer 2 dental plans through Blue Cross Blue Shield of South Carolina. We have a high option and low option. Our high option has a $1,000 annual maximum. It has the same benefits in and out of network. If you go to a non-PPO dentist, you'll get reimbursed at the 90th percentile. And then it includes dependent orthodontia. For children up to age 19, you get $1,000 on the orthodontia benefit, or you could get kind of a pared-down dental plan at a lower price point. We also offer 1 vision plan through Blue Cross Blue Shield, utilizing the iMed network, which is one of the largest national networks out there at very competitive rates. And as I mentioned before, we're open for business and eager to talk to member organizations who are interested. My contact information is up here, my phone number, my email address. Ben has also set up an interest form on the Together SC website on providing some basic information for us to reach out to you and talk to you about the benefits of participating. So we're real excited to be partnering with Together SC on this association health plan. We've already had some great conversations with nonprofits throughout the state. It's pretty amazing, myself and our staff here, when we listen in to what everyone's doing out there and how you're helping members in the community from kids up to senior citizens. It's great to see all the time and effort that people are spending trying to improve our communities across the state. So anyway, thank you for your time this afternoon. I'll be on here. We're happy to answer any questions that you might have. I did also want to, turn things over to Will Joseph at Blue Cross Blue Shield, and he was going to talk a little bit about Blue Cross and their assistance in putting this together.
Very good. Thank you, David. Hold on, let me take over control here real quick. All right, David, thank you for that introduction and that overview. And as David said, my name is Will Joseph. Can everybody hear me all right? And I'm the manager of Association Health Plans for the state of South Carolina. We have 12 different association health plans currently operating, Together SC being the newest one. As David pointed out, we're one of the leaders in the market, the only carrier operating association health plans in the state. You'll sometimes see some big national programs, but when you get down to what we're doing, they're not true association health plans. So happy to be joining together with Together SC, and our partnership with United Way has been pointed out was a big a big driver behind this. So we're happy to all be working together and look forward to a lot of success together. So this is going to be a very high level overview, but just talk a little bit about the association health plans. The first thing, and again, David pointed a lot of this out, so apologies for rehashing some of this, but association health plans are only available to Together SC members. So this is a plan that we're going to look at together. It's designed to offer cost savings. We've got limited plan options, 18 plan options, and quality benefits. It's a great option for all companies. So this is primarily pulled together for smaller employers, kind of that under 51 eligible, which we classify as a small group, but we also have a lot of larger groups participating. One of our associations, they had about a 250 member group just come into the association this year. We're really seeing where price is king in the market right now. And so even those larger employers, since we are a true large group plan, they are looking at association health plans and see the value there. We primarily compete against kind of the ACA small group market, and we see a lot of employers come in with people on individual plans. So, always important for people to realize, hey, this is a true major group benefit option. So you get all the benefits from disease management to kind of the value adds that are included as a large group Blue Cross and Blue Shield member. And that opens it up to our smaller members throughout the state. This is all insured through Blue Cross and Blue Shield of South Carolina. So all the employers are coming together to form one large group, and that gives you underwriting efficiencies, regulatory advantages, and then greater negotiating power. Majority of our associations are anywhere between 550 and 1,600 members. And so once you grow your pool of membership a lot larger, it helps you kind of mitigate some of those factors. If you've got a very sick individual under there, you're banding together. So when everyone else is having a good year and you're having a bad year, it helps you offset those costs. And our trends tend to be about half of what we see in the medical trend. And when I say trend, all that is basically medical inflation. Throughout the country last year, it was a little bit over 7%, and they're projecting it to drop hopefully a little bit next year, or this year, I should say, 2022. But obviously with COVID, we're starting to see some of those long-term effects there. So this gives us all a chance to come together. This is just going to be TSC members. So when we're looking at it, we're going to rate everyone together. And then that makes sure that we can hopefully help hold down costs in the future as we continue to deal with COVID and other medical issues. So a little bit about Blue Cross and Blue Shield of South Carolina. We're an A+ rated carrier. That's the AM Best rating at 16 years consecutively. And that just means as a fiduciary, if something goes wrong, like a pandemic happens, we have the reserves there and the wherewithal to be able to withstand something like that. We're the market leader in the state of South Carolina. I think anybody that lives in the state knows who Blue Cross and Blue Shield of South Carolina is. They always say, if you ask if somebody has health insurance in the state, they say, yeah, I have Blue Cross. A lot of people in the state just think of that as health insurance. The 18 plan designs that David gave an overview over. The other thing is the composite rate structure. Any of those small group employers currently are probably accustomed to that you've got different rates for different employees, which can be a little bit to administer, and you're trying to figure out compensation based off of that. And so there's no age banding, there's no male, female, no tobacco rating, anything like that. It's just a one rate for all employees. Makes it a lot easier to administer. And then again, all our ancillary coverages are again tied back to the association. So those are just for the association members, but we do have dental, vision, life, and disability as well. Touching a little bit on our administrative efficiencies, we do have a single online enrollment platform for all your benefits. That's helped, Capstone helps us administer that. It's a great platform. It really simplifies kind of the work on the HR side for enrolling different benefits. You get one consolidated bill for all lines of coverage. So it's not like, hey, you've got a bill for medical, bill for dental, bill for vision, bill for life. It's one consolidated bill for all different lines. COBRA administration is included in here since this is forming a large group health plan. That's all done through Capstone. They've got compliance dashboard. Capstone's got a lot of additional benefits that they can offer to y'all as well. And they've been a great partner for us over the years. Mark Lamberth is on the call. He's been instrumental in helping us set up the association health plan. He's a wealth of knowledge. I started in this position about 2 years ago, and he's my go-to guy for any questions association health plan related. So we've got a great team around this, along with David. Marsh McLennan is obviously a huge presence in the state and one of the premier agencies in the state. So great team around this. and we're all excited to be working together to support the nonprofits in the state. Last thing is just touching a little bit on Marsh McLennan. They're quoting and implementation support. This is all local, so I'm based out of Columbia. David's based out of Greenville. Blue Cross Blue Shield as a company is all here locally, and I believe David's team is all based around him up in Greenville and throughout the state as well. So I mean, he's your all-in-one point for all marketing, facilitating quote and underwriting process, presenting options, and implementation assistance. With presenting options, when we're growing an association health plan on the front end, you're trying to bring, good to decent risk in on the front end to prop the association up. So I will say, we've got a lot of groups interested in coming in. We actually fully underwrite the business, whereas on the ACA, on the metallic marketplace, you're just going out there. It's all based on your age and your sex, and that's how you get your rates. This is fully underwritten. So David will always present all your options to you, make sure that he's doing the best for each individual group, and obviously we want the association health plan to be the option that you go with. But if it's coming in and you've got a lot of health issues going on currently, somebody asked down the chat earlier, do we exclude pre-existing conditions? No, we do not. And if you've got basic health issues going on, that's not a big thing. But if there's a major medical issue out there, just realize, hey, we want to be the option for you. We may not be the option this year, just because we are really trying to grow this out. And so if you've got, always kind of reference hemophiliac, that's disease. It can be about $1 million to $2 million per year just in medication and ongoing costs. It would be hard for us to absorb that at this time. So as we grow to a larger association, that'll open this up more and more, allows us to get more and more cost effective. But just I do want to point that out, that we are underwriting this business. So don't want anybody to get frustrated if we're not the cheapest option the first year. Continue to think about us as your option for the future, and hopefully we'll be growing this association very quickly, all coming together, and then helping to hold all our prices down in the future. That's it for me on my side. With that, I'll turn it back over to Ben, and Ben, I think we're going to be doing the Q&A here in a little while, so I'll stick around for some questions.
Yeah, and we've got a lot of questions. And David and I and Will have been trading off trying to answer them as we're going. And I'll start back in just so that everybody can hear the answers. I want to note, whatever it was I was going to note has flown clean out of my brain. I'm sorry. So perhaps it will come back to me as we go through some of these questions. So going back at the top, so the slides, the flyers that we've mentioned, I'm going to post all of those on the Together SC website. We did a blog post a little bit earlier in the year, and I'm going to update that and put the newest information on that and send that out to y'all in the follow-up email. Oh, I remember now what I was going to say. I do want to manage some expectations, because since we have announced this, we have been inundated with requests for more information, which I think is great. It's wonderful. I'm so glad that y'all are as excited about this as I am. David and his team are working through the list of people who've been interested and already reached out to us as quickly as they can. So it may be a week before you hear back. Just know that when you fill out that interest form, you'll get an answer back. I think in my own experience, in terms of from when I first said, hey, I want more information, because we're going into our own plan here at Together SC, of course. I got the documents and the paperwork and the forms and everything. I was able to turn that around in about 3 or 4 days, if I recall correctly. I sent that back to David. I think I got the proposal back from Blue Cross Blue Shield in about a week and a half after that. And I started filling out the rest of the paperwork and getting us enrolled. So we're looking at a March 1st start date for our own team here at Together SC. It didn't really take that long to get through it. But it is not something that can happen instantly. So I just want to let folks be aware of that. It does take a little bit of time to get the paperwork back and forth, but I think it's well worth it. So going through questions here.
Do you want me to work through some of these, Ben? I was kind of going back up. through them.
Yeah, well, I think that, yeah, I
Let's-
think
Yeah,
let's
I
just
was going to start with Caprice. It looks like her question. I'm just trying. I know David and you have been trading off, and Caprice had asked, "Is each individual organization rated each year, even though we are part of a large association?" The answer to that is yes. You still have your individual tier, but the benefit you get is obviously, if you're. And we talk about loss ratio a lot in the industry. It's how much premium you've paid versus how much that we paid out in claims, and so. In a year where maybe you've got a 100% loss ratio, if all the other groups under the association are running at a 60% or a 70% loss ratio, then that's going to eliminate the need for any kind of cost increase on your plan. So even though you're rated individually, and we take into account your demographics, which is your age, and then again, you're underwriting it. And so if you've got a lot of members taking high cost medications and all that, that can change which tier you fall into. So yes, each one is individually rated each year. And I think David talked about this, is the plan renews on 1/1, but you can come in anytime in the year. We're never looking to increase your rates in the first year. So we're always trying to hold your rates through the renewal if you're coming on the first year. The caveat to that is if you come in and there is a very large high dollar claim, and this has not happened to me, knock on wood, in the 3 years I've been here. We haven't had to increase anybody once they're coming into that first year. But if you've got something going on, obviously if it's having an outsized risk on the association, that becomes very difficult. And so we'll have a conversation with you at that point. But we all just have to realize we're in this together. We're a growing association. And so even though you're coming on, it'll basically move your effective date to 1/1 every year. So I just want to make sure we did touch on that. A lot of questions about, employee counts. I think David's done a good job of getting to most of those in there. Yes, there are disability and life insurance plans. We can do custom options. We're working on a kind of standard option as well that's block rated for the entire association. The dental premiums were all based on monthly costs. So those were the monthly rates for dental. Those have been very competitive in the market. We tend to have the majority of our associations, the members that sign up for the medical will take the dental. There is no difference in the rates. I should say this, if it's employer contributed or not. It just imposes some waiting periods if there is no employer contribution there to the dental. Yes, you have.
And I might chime in. We're having some great conversations with groups about plan design options. So, a lot of times someone might have bought a gold option, small group, and, so we're having a lot of good discussions regarding, deductibles, co-pays, high deductible health plans. The health incentive accounts are really popular. So, and when you do get a proposal, you're going to see all 18 options in the proposal. So it really opens up a lot of options for you in discussions to kind of revisit, what you want to offer, how much you subsidize it, and giving maybe a second option to employees to choose from.
Mm-hmm. I'll say what we did for us at Together SC is when we got those plan options, rather than say, I just pick which two we want to actually offer. We had sat down with our staff and just reviewed all the options together and said, okay, are there two in here that we can all agree on that we want one of them? And we were able to work through those and decide collectively on two plan options that we wanted to make the official ones. And that really worked out well for all of us. Easier to do with a small staff, obviously. Can we go back on to go on the pre-existing conditions again, because I'm seeing some questions about that, and I just want to be clear, what that means. Am I correct in saying that denial for pre-existing conditions is no longer allowed under the
Correct.
ACA?
Yep.
It's just a question of what price tier you would get put in.
That's spot on. The ACA did away with any pre-existing condition exclusions, anything like that. It's just, if you've got, I would say a member that's experiencing very high cost claims, we're a young association trying to, we'd love to be that 1,500 man association out there, able to support a lot more. And obviously you've got a lot more premium behind it there, but yeah, that's going to change your cost tiering. And, we see a lot of, you never look at a group and there's nothing going on. So don't think, hey, we've got one thing going on that's going to exclude us from this. But if you've got a member, recently we had a group come through and they had a family that had some very rare genetic disorders, and the drugs for each of the children were about $250,000. And so that becomes a situation where it's very hard for us to price that. Our association was about 400 lives, but it was very difficult for us to take that on, because what would happen is you bring that group in, it elevates the cost for everybody. And so we'll never decline it for a pre-existing condition, but that to Ben's point, that could change up your pricing a little bit if it was a major issue.
And so what that means is you may get a price quote that is not the best price quote you could get if you went through other insurance options. And that may be for the first year or so from us. But as to Will's point, the more we grow the plan, the more folks we get into it, the larger the plan becomes, the better the pricing tiers get, the more able we are to control the costs. My dream would be, and maybe Will's eyes will go wide if I say this, but my dream would be that every nonprofit in the state would be in this plan. That may never happen, but that would be like the really sweet spot for all of us, to have that enormous risk pool that could mitigate things like that, and we would be able to include folks with more serious pre-existing conditions at a much better cost. So, that's to reiterate, we can get folks with pre-existing conditions into the plan. We just may not be your best option. You may be able to get coverage from someone else for a better rate. And so I don't, yeah, I'm a social worker at heart. I don't want to feel like we could exclude anybody, but we do want to be clear about that. Seeing questions about the renewal period. The official start date is January 1st for everyone, but we can get you in at any point in this year, or at any time. The start dates are always on the first of the month. Is that right? For
Yep,
folks coming
it's
in
always
mid-year.
the first, right?
Yeah. So right now we're trying to get folks in for March 1. As we get a little bit closer to March 1, we'll start trying to get folks in for April 1. So just keep that in mind as you're thinking, okay, how long will it take to do the paperwork and get information and things? At this stage, it may be April 1 start date for most folks.
Yeah, and I might add too that we've had situations where someone comes on middle of the year, we can provide deductible credit. If we're replacing other group coverage, and let's say you had a January 1 date and you come on 3/1, we can provide deductible credit for the first 2 months of the year. So we are flexible in doing that. So I just want to point that out.
And I've seen questions here about, does this include spouse and family coverage? Yes, it does. It is, of course, up to the organization to determine how much that you contribute to your employees, employer-only coverage or family coverage. But those options are available. This is for full-time employees. Full-time being defined as anybody working 30 or more hours a week. So unfortunately, part-time employees under 30 hours a week and 1099 contractors are not eligible under this plan. Let's see. Teresa, you had specifically said, hey, what if we have 2 full-time employees, but only one needs coverage? I've had that question from another organization. The absolute minimum, unfortunately, is that you have to have at very least 2 participating full-time employees. We've got some other options outside of the AHP. For folks that only have 1 employee or something like that. I can make some referrals for you with one of our other partners outside of the AHP. David may be able to work something up for you outside of the AHP if you need that as well.
And we do, the other question is HSA options, flex spending account, HRA. We do have all those options available either through Blue Cross Blue Shield South Carolina or Marsh McLennan Agency. So we can definitely accommodate that. And, once again, the 5 plan designs that are qualified high deductible health plans, you'll want to take advantage of that health savings account option.
Yeah. And I want to mention from the administrative side, being the guy who has to pay the bills together SC, having the administration be as easy as possible is really important to me. ideally, the way it's set up with the system from Capstone Administrators, you just get a monthly invoice. And the billing is automatically set up, automatic draft, the same amount each month. It makes it so much easier for you as an organization to include this in your budget. Those of you who are on a January 1 start date, you'll get the new plan figures and everything in time to budget for the next year. Those of you who are on a July 1st start date, you'll already have some information about the first half of the year in order to do that budgeting much easier. Let's see, what other questions do we have here?
There's a question about the HIA plans, so I'll talk a little bit about that. Those are our last two plan options, and what they are is they're plans that give you a deductible credit for getting, I say the services you should be getting done, but for getting your basic wellness services done. So going to get your annual physical, if you've got the dental with the association, going to get your annual dental screening. And what those do is there's nothing for the member to file. And this is why I say it's kind of a soft wellness approach. And it says, well, your deductible is X. We're going to give you a credit depending on your deductible to help you buy down that deductible. And so what that allows you to do is members go out and get that service done. It automatically files a claim against our system, and it automatically buys that member's deductible down. So it lets you go with a little bit higher deductible health plan, but with the option of members saying, and that's really us trying to encourage, if you get your annual physical done, you're going to catch things a lot earlier, which is going to be a lot easier to treat. If you're going to get your annual dental screening done, your overall dental health is going to be better every year. So it's really incentivizing employees and saying, hey, your deductible's here, but you can lower your deductible by just going to get those services done. There's also an online health wellness survey. And basically all that does is it provides you with kind of your Rally age or your Rally health score. And that just says, based on the factors that are currently there in your life, this is kind of where we score you. And so it gives you kind of a nice way to quantify, okay, here's where my health stands currently. Here are some things I could be doing, or here are probably some areas I need to focus on next year to help me improve my health for next year. So a great tool, something I was a sales rep for 3 years, something I put into almost every group just to try to incentivize that. And then that lets the employer as well say, okay, employees, y'all have some skin in the game. If you're getting your annual physical done, if you're getting your dental screening done, that's going to help us lower our cost over time. And that, that allows you to buy down that deductible back to, to that level where it's a good bit lower than it is currently. So good question there.
And I don't mind sharing that I opted for one of those plans, for the health incentive account plan, because heck, I'm already doing that. Like, I'm already going to the doctor twice a year for wellness check. I'm already, exercising mostly regularly. Need to get back into that. But so that plan really works out for me in that case. We have a question about from Amy at Horry County First Steps. Will an employee lose access upon retirement from the organization? Now, these plans have COBRA options, right?
Yes. There is COBRAs available. And the other thing is what we're seeing, and we represent hundreds of employers across the state. If someone, there's no formal retiree benefit, right? So if someone leaves, they're going to be able to opt for COBRA for up to 18 months. After that period of time, if you are Medicare eligible, well, most people are going to go on Medicare at age 65 anyway. If you are under Medicare eligibility, we have someone within the agency who can quote individual health options. And, there are subsidies based on income levels where you could typically buy, a fairly affordable individual plan to kind of bridge you to Medicare eligibility. So a lot of different options there, but there's no group retiree coverage under the program.
We've got a question about employees being hired mid-month. So, typically any organization will also have an internal policy that says, hey, when we hire you, you're not eligible for benefits until 30 days or 60 days. After you're hired, and then it would start on the first of the month after that period has elapsed. So you hire somebody, let's say you hire someone on the 15th of the month, and your policy is they don't get, they're not eligible for health insurance for 30 days after they're hired. Then that means that 30-day period would expire on the 15th of the next month. They would be eligible really on the first of the following month. if you say, hey, you get health benefits immediately upon being hiring, really it's the first of the month after they're hired.
Yeah, I mean, we typically see the most common waiting periods of first of the month following 30 days of employment, and then first of the month following 60 days. That's common. Will, are you able to accommodate a 90-day waiting period, or?
It's always going to be first of the month following. So that's just, it helps us simplifies things on the
Yeah,
capstone
so
side.
it's going
Yeah,
to be first of the month following 60, because you can't have a waiting period greater than 90 days.
correct.
Right. Yeah, and we had in our organizational policy that it was 90 days, and we've had to go back and change that policy because of that. And so, hey, it works out. So yeah, so we've got FSAs, HSAs for the high deductible health plans. We've got some answers on that questions. Looking to see if there's any others. You all seeing anything? I think we've covered most of the questions. Has anybody not got their question answered? If you want to unmic, I know we're getting close to the top of the hour. If anybody wants to unmic or pop it back into the chat box in case we accidentally missed you. Janie's asking if what if employees don't work 30 hours a week all year? Does that have to be like all year, or is it on average?
I mean, Will, we're still working 30 more hours a week for roughly 48 weeks per year.
Correct.
Yeah. So, I mean, really, and that's the Affordable Care Act, and that's the definition of full-time employees. So that's pretty much what all the group health carriers are running with now, 30 or more for at least 48 weeks per year.
Awesome. Excellent. All right. Well, I'm not hearing anybody unmuting and saying, hey, wait. Answer my question. Oh, here's a good one. Joan asks, I have an employee scheduled for surgery second week of March. If we switch, would they have to go through pre-authorization again?
Yeah, so that might be one that you might want to wait till 4/1. Because, we run into situations like that. I mean, we're kind of bumping up against March 1, and we still got some people joining us for March 1. But, if the paperwork hasn't been completed by now, I would say it's probably best to look at a 4/1 effective day, let that person get their situation squared away, and then the group can come on 4/1. And, in group health policies, it's really month to month that you're able to cancel at any point in time.
Yeah. I'll say I may have rescheduled my upcoming dentist appointment so that it's after March 1st. Because my dentist is actually in the network for the new plan. Okay. Well, thank you, folks. It's 1 o'clock, and I want to be respectful of everyone's time. If you've got questions that pop up in your brain after this, and you say, dang, I wish I'd asked that, feel free to shoot me an email. David's contact information has been posted as well. We'll send out a follow-up email with a link to the webpage and everything, and the interest form. And I do just ask that you bear with us as we work through all of the folks who are requesting more information. I anticipate that interest form is going to go boom in the next couple of days. So we'll promise we will get to you as soon as we can, and we'll try to get everybody who wants to be in the plan as quickly as we can. So thank you all very much for joining us for this call today.